Afternoon, everyone, and thank you very much for having me. I'm sorry I missed part of the morning. I'm not quite as tall as Adam, so I'm going to have to adjust the mic and find my name. So I'm going to follow on from, if I find the right one, from Adam on sort of looking at where we are and with the community. And if you go outside of the UK, we're sort of viewed by vast majority of Europe, America, and lots of other countries that this is the stage where we are at for our diabetic care. And the main reason for that is because we have screening, we have integrated care. So to them, it seems that we have got so much more than a lot of other countries can offer. But if we come back to our own thinking, we do know that we are somewhere along the line of this sort of continuum. We know what we would like. We don't quite understand if someone else knows what we would like. Certainly we have a lot of understanding issues or misunderstanding issues between what patients, what healthcare professionals, what the community would like and what we can deliver. As you know, that we are not all great at documenting what we do, because sometimes life just overtakes us and we do your laser, but we might not write as much in the notes as we would like. And this is all you wanted. And days like today are absolutely essential for us to be able to work together and understand where we can meet somewhere halfway. We were probably never going to have enough money to cover every single aspect of diabetes and diabetes care just from the healthcare sector. But it's very important that we cover the ones that make the most difference. Those healthcare professionals who you see here today, they are all of those people, and also those who you see in clinics and screening. They're all of those people who decided that they wanted to be sort of somewhere along the diabetes care line and stop people going blind. Because as you know, that's one of the biggest risks from our point of view for patients with diabetes. So what can we do together? Well, we do find that a lot of people are very frightened of asking questions, and we don't really understand sometimes what you would like to know. It might be that my biggest problem is that you have a little bit of fluid in the back of the eye, but your biggest problem is, am I going to be able to get to the school by 3:30 to pick my child up? So that's a huge discrepancy between expectations. So we've got to be able to meet somewhere along the line. And if you have lots of questions, do write them down and come with a list, because however silly it looks, everyone forgets everything when they get to the doctor. I would really like to caution you every now and again to listen to others with the same disease. There are lots and lots of different types of lasers you can have. And just because someone had laser and went blind, it doesn't mean you will have laser and you go blind. We might have had to do the laser at a time when it was so late that nothing else could have helped. But make sure that you listen to good advice and you really, really take in what will help you. And if you are not sure, ask more questions. Also, the internet is a fantastic resource, but remember, a lot of the times only people who have had really bad experiences and they are not out there, they're not climbing mountains, they are not at work, they are the ones who have the most time to write. Some blogs are excellent, some are not that great, and it's very difficult to see and critically appraise what goes on. So make sure that sort of Diabetes Days, Diabetes UK, and everyone else, such as your diabetes nurse and practice nurse, they have fantastic information. They can have fantastic information for you, especially if they are trained, that a lot of the diabetes centers now do. We have practically trained every practice nurse and practice manager in Tower Hamlets. So they all have basic diabetes information. And a lot of the times, if you have family members with diabetes, they can provide you with a lot of support, and it's very good support a lot of the times because they know you, they know your habits, they will be able to tell you about their eating habits as well. Even if I read up on a lot of the culture's different diets, I can't be the expert on all. And as Adam said, Diabetes UK is great. So I'm going to just show you one case before I will let the treatment and then the future to come and talk to you, as how serious business diabetes is. These are the cases we thought we would never see again in the UK. And so this was a 41-year-old man who's been the patient told me that he thought he had diabetes for 20 years. The GP thought it was 9 years. So, you know, even if we meet somewhere along the halfway, it's a good 15 years. He's never been seen by an ophthalmologist, never been to his optician, because a lot of the people who have good eyesight, they don't start going to their optician until they are 45, 50 and need reading glasses. So he presented to our eye casualty with sudden visual loss in the eye. As you know, the top letter on the chart is 660, so if you don't see the top letter on the chart, you are below, and he could only see counting fingers in the left eye. And I'm going to go to the bigger picture so you can see this is all blood in the eye. And this is the stage we've seen him, first time. And the other eye, this is the part of the eye where you should see the best. And of course, because this is all covered by a big scar, the patient couldn't see well. So if we do the first scene, a yellow dye, what we are looking for is the general view is black is really bad, too white isn't good, anything grey in between is usually pretty good. So you've just had a really good tutorial on fluorescein and geography, and now you are all experts. So anything that's really black is not good, anything is very white is not good. So there isn't really much good in this because it's either very black or very white. So this patient eventually ended up having lots and lots of laser, then needed vitreoretinal surgery, and actually Professor Bainbridge did that. And now this patient can read half of the chart with one eye. So it's not all lost, even at that stage of the disease. So we can actually help a lot. But as the twins, thank you very much for the introduction this morning, told you this morning, you know, sometimes you are our guest for a considerable amount of time in the first year after you have been diagnosed with such disease. It's not going to be for the rest of your life. A lot of the times what we tell you that if you can bear with us for about a year through all the bad things that are happening, then at the end of the year, you usually come out at the end of the tunnel and things are looking up after that. But if we lose you during that 1 year, then it's very difficult to gain the time back. So, but there are also lots and lots of things. You all know that the NHS is changing. We're not quite sure what's going to happen to pretty much any of us. So hopefully we will be able to to keep this dialogue up, to make sure that we don't lose this fantastic opportunity that's been brought in sort of about 10 to 12 years ago for the screening and the integrated healthcare and clinician review. So we absolutely need teamwork. We also need you to be quite vocal about what you would like us to do for you and in what circumstances, because otherwise we will not be able to deliver, especially not be able to deliver when we need to find the 20 billion pounds that the government would like us to find. So we really need to all work together and make sure that all of us can see the light at the end of the tunnel, and your light and my light and we are in the same tunnel and we are aiming for the same light. Otherwise, we're not going to be able to help you. So without further ado, I think what we need to do is I've tried to highlight, Adam and I tried to highlight the journey and you get to clinic and the ways we would like you to come to clinic, which is the very early changes of diabetes and not the case that I've shown you. And then from now on, we'll talk a little bit more about what happens when you do, in reality, when you do come with more changes and what the future will hold. Thank you very much.